Chapter 18 deals with IV medication and titration calculations. Titration is when we usually use this in IV medications, and when it's when we adjust a dosage within a specific range, and we may increase it or decrease it to obtain a desirable, measurable physiologic response. Examples of that might be titrating insulin for blood sugars, or titrating a medication to keep a blood pressure within certain parameters. We typically do this in critical care situations or in life-threatening situations to alter or maintain vital physiological functions, as I mentioned before, such as blood pressure. Medications that require titration are rapid acting. They have very short duration and a narrow margin of safety. So you are continuously monitoring whatever physiological function you are trying to maintain within a specific parameter, and you are increasing or decreasing that titration rate to maintain that specific physiological parameter. Dosages are calculated to the nearest tenth, and flow rates are rounded to the nearest milliliter. There are some EIDs that can administer medication to a tenth of a milliliter, so you have to be familiar with your particular electronic infusion device. If you have a pump that can deliver a tenth of a milliliter, then you can set it accordingly. When a physician delivers an order for titrated medication, it may be either by dosage, where they will give you a certain microgram or milligram or unit per minute or per hour that we deliver to the patient, or they may give it by body weight, micrograms or milligrams or units per kilogram per minute or per hour. Here is a specific example. You may have a drug that is prescribed to infuse within a specific range. You may have a range such as 1 to 3 micrograms per minute that you can infuse to achieve a specific physiological response. For example, you may have a physiologic parameter of systolic blood pressure that you want to maintain at greater than 100 millimeters of mercury, and you titrate between 1 and 3 micrograms per minute to maintain that systolic blood pressure greater than 100 millimeters of mercury. Ideally, and almost in every setting, you will be using an electronic infusion device, and so that would be either a volumetric pump or a syringe pump. And the pump will display dosage and flow rates, and it can be set to deliver fractional dosages. It is not recommended that you not use EIDs for these types of titrated medications. The only time that you might do that is in, say, maybe an ER setting when you do not have access to an electronic infusion device. So, as I said before, titrating using drops per minute, which of course would be without a volumetric infusion pump, which gives it to you in milliliters per hour, that is not recommended. But if it's not available, an EID or a syringe pump, you want to use a microdrip tubing, which, as you recall from earlier chapters, is 60 drops per milliliter. And if you'll remember, your rate in drops per minute when you use a microdrip tubing is always the same as milliliters per hour. This slide basically says the same thing. You're going to use an electronic infusion device for administration, and the flow rates are going to be calculated in milliliters per hour for the lowest and the highest dosage that's prescribed, and it's adjusted within this range to elicit the desired physiologic response, which you will have ordered as well. So on this particular example, you've got a cardiac medication, and the dosage strength is going to be 125 milligrams per milliliter. The doctor wants you to infuse that dosage strength at a rate of 20 milligrams per hour. So to calculate the milliliter per hour flow rate, you're going to have to start with milliliters per hour, just as we've done with our dimensional analysis in previous problems. And so we'll go to the next slide and see how that's done. So here we see we want to end up with our milliliters per hour, so we start with milliliters per hour. This is our dosage strength, which is what we have. That's our dosage strength. And then we're going to take that times, we're going to match up our denominator and our numerator, and what we want to deliver is 20 milligrams per hour. So then we can cancel out our milligrams and we're left with milliliters per hour. So then we would work that out, which would be 100 over 125 times 20 over 1, and you could reduce that down if you wanted to. And when you work that out, you would come out with 16 milliliters per hour would deliver 20 milligrams per hour using the 125 milligrams per 100 milliliter dosage strength. Now this one is going to be the same way. It's telling us to calculate our milliliters per hour, so we're going to start with milliliters per hour equals, as we'll see on the next slide. But this one, your dosage strength is your 8 milligrams in 250 milliliter solution, and the doctor wants 2 micrograms per minute ordered. So the extra step in this one will be our conversion step. So you'll have to have a conversion step in this one because you're using milligrams and the doctor has ordered micrograms. So here you can see that we start off with our milliliters per hour because that's what we want to end up with. Here's our dosage strength, 8 milligrams in 250 milliliters. We're going to match up our denominator and our numerator. We know that 1 milligram is equal to 1,000 micrograms, and then we can put our ordered dosage, which is 2 micrograms per 1 minute, and then we're going to want to convert that. This is just a second conversion because we're converting minutes to hours because we want to end up with hours. So you've got your 1 minute here and then 60 minutes here is equal to 1 hour. So then if we go back through, we can cancel out our milligrams, cancel out our micrograms, and cancel out our minutes, which will leave us with milliliters per hour. So if you then work that problem out, you will come out with 3.75 or 4 milliliters per hour. Now if you did have an EID pump that delivered fractions of a milliliter, you could give here 3.8 milliliters per hour. That would just depend on your pump, and so your problems will tell you, if you're on a test, it will tell you what to round it to. If it doesn't say anything, you round it to a whole number. Now in example number 3, it is using weight as a prescribed order. And so what the doctor is asking is for it to be given at a rate of 3 micrograms per kilogram per minute. And so what we'll do first is a two-step. This is a two-step flow rate calculation per dosage per kilogram ordered. Your solution strength is this, 400 milligrams in 250 milliliters, and what we're doing is calculating the milliliters per hour flow rate. So we know we're going to start with milliliters per hour equals. But we will first have to do a step of finding out what our dosage is based on the weight. It'll show us that in the next slide. Here we have that worked out. It says to calculate 3 micrograms per minute dosage for 95.9 kilograms. So you're going to take your 3 micrograms times your kilograms, which was this, so that if you take 95 times 9, or 0.9, I'm sorry, times 3 micrograms, you're going to come out with 287.7 micrograms per minute that this patient can have based on their weight. So now we know that what we're doing is we're calculating our milliliter per hour flow rate for this specific micrograms per minute. So we start with our milliliters per hour. Here's our dosage strength. Here is our conversion step. Here is what we calculated as our dosage per minute. Then we're doing our next conversion right here, 60 minutes over 1 hour. So you go back in and we cancel out our milligrams, our micrograms, let's see, oh yeah, right here, 1 milligram is this many micrograms, and this should say, this is an error right here, this should say micrograms, sorry, because we already know that it's 287.7 micrograms per minute. We cancel out our micrograms here, cancel out our minutes, and we're left with our milliliters per hour. Then we multiply across and we come out with 10.79 or 11 milliliters per hour. So this right here was an error on this slide. This should be micrograms. Okay, now we can do the same problem using a one-step method where our calculation of 3 micrograms per the 95 point whatever it was, however many, 95.9 kilograms is included in the long equation. The first two ratios are going to be the same as the two-step method. So we're going to start with our milliliters per hour. This is going to be our dosage strength. So I'm just going to abbreviate that, dosage strength. Then this is going to be our first conversion step right here, because we're converting to micrograms. Then this next step is where it differs a little bit. We know that we had gotten to this point. We know that this is what we want to end up with. This was our dosage strength. This was our first conversion. So then we match our denominator with our numerator, and we know that the order was 3 micrograms per kilogram per minute. And so we're going to have to use both of these denominators in our next two steps. So both the kilogram and the minutes must be matched in the next numerators. Either can be used first, but the minute is the best choice because the conversion ratio is needed to change minutes to hours, and that's what we've been doing. So we've got our 3 milligrams per kilogram per minute, so we can put our 60 minutes is equal to 1 hour here. So then our next step, our numerator is going to have to include this so that we can cancel out both of these denominators. And you can see that that's what's done here. We started here. That was our dosage strength. Here's our conversion. Here's our dose. Here's our next conversion to hours. And now we've got to take care of this kilogram. So now's when we're going to plug in our kilogram in our numerator here to be able to cancel out this denominator and this numerator. So we just did that in the next two steps here. So now let's look and see if we've ended up with milliliters per hour. That's what we want. We started with that. That's what we want to end with. So we cancel out our milligrams. We cancel out our micrograms. We cancel out our minutes. And we cancel out our kilograms. That leaves us with milliliters per hour. So then we multiply across, we come out with 10.79 or 11 milliliters, which we did before. So it's the very same thing, except we plug in our 3 micrograms per kilogram per minute and just work it in one long equation, rather than taking our kilograms times our 95.9 kilograms in a separate step and then working the equation. Now in this one it's asking us to titrate an IV infusion, and so it's giving us a range of the dosage being 2 to 4 micrograms per minute. So what we would do is we would raise and lower the IV rate from 2 to 4 micrograms per minute in order to keep a certain physiological parameter within the range that has been ordered. So the solution being titrated, here's the dosage strength, 8 milligrams in 250 milliliters, and you're to calculate the flow rate for medication of the medication for 2 to 4 microgram range. So you're going to have two numbers, or you're going to have a range in milliliters per hour, because you've got an order that is a range. So in this example, we're still using our dimensional analysis. We're starting with our low end right here, because it was 2 to 4 micrograms. So we're going to set it up the same way. We've got our milliliters per hour that we want to end up with. Here's our dosage strength, 8 milligrams in 250 milliliters. Here's our first conversion step, because we're converting milligrams to micrograms. So you've got 1 milligram is equal to 1,000 micrograms. Then you put in your first order, 2 micrograms per minute. Here's our second conversion step for the time. And then we go back and we can cancel out milligrams, micrograms, minutes, and we're left again with milliliters per hour. We multiply that across, we come out with 3.75 or 4 milliliters per hour for our lower lower rate. This is the same problem, they just haven't gone through and written the numbers in here without the labels. And so it's basically they've just multiplied across the numerators and denominators and come out with 4 milliliters per hour.